Today I want to challenge the commonly held belief that all anterior cruciate ligament injuries of the knee need surgery. A common patient journey would look something like this, especially where I work in the city of Sydney. A player has a twisting knee injury with an episode of giving way. They have an MRI scan, often bypassing a thorough clinical history and examination, run a little Google search, and end up on the operating table, often within a few weeks. This would seem to make logical sense. Something is broken, go ahead and fix it. But we have to look at the real world outcomes to know if this is indeed the best solution. Let's have a look at some work from the Canon trial. These results are from the 5-year follow-up of the study, which looks at the outcomes of surgical versus non-surgical interventions to treat ACL injuries. The researchers enrolled active young patients playing tennis, soccer, skiing and other challenging sports, and randomly separated them into two groups. Half had early ACL surgery, and the remaining started with rehabilitation, undergoing delayed ACL surgery if they remained unstable. The take-home message from this slide is that only half the rehab group were unstable and required surgery. This suggests that only half of all people with ACL injury will need surgery to feel stable. It doesn't, unfortunately, tell us which half that is. These are the 2-year data looking at the patient-reported outcome measure called a KOOS score, which is a survey looking at how a patient rates the various aspects of their knee function. At 2 years, there is no difference between the groups having surgery and having rehab, with the best outcomes occurring sooner in the group having rehab alone. This makes sense as the time to get back after ACL surgery is at least 12 months for the average person. We have not factored in the considerable financial cost of surgical treatment into the equation at this stage. Another way to look at the results is how often patients are able to return to the activities and sports they played before their injury. This is often cited as a reason to undergo reconstructive surgery. Only 20% of people actually return to their previous level of sports activity, and this is regardless of how their injury is treated. Psychological readiness is also important when it comes to returning to sports. What about other outcomes? In this study, X-ray changes of osteoarthritis were no different between groups, although this finding may not hold true across all research. Surgery required for meniscus or cartilage tears was no different between the groups. And 4 of the patients who had reconstructive surgery eventually ruptured their graft. Around 5% is often quoted as the acceptable failure rate in adults for this style of surgery. So who needs a reconstruction? Reconstruction probably doesn't increase your chance of returning to your previous sport and is not required to get you playing with your kids in the backyard. It may not even decrease your risk of developing osteoarthritis. If you're an elite athlete, surgery, however, offers you a more predictable pathway. You know you can be back playing by 9 to 12 months. Those with cartilage or meniscus injury who need surgery should perhaps elect to have a reconstruction at the same time. And those with persistent instability despite rehabilitation and activity modification could elect to have surgery if they're not able to modify their activities to avoid instability episodes. Who probably doesn't need reconstruction surgery? Those who want to play non-pivoting sports, and I include skiing in this, as whilst you often rupture your ACL skiing, you don't really need it to ski. Those people who are willing to change their activities to non-pivoting sports like running, cycling, swimming, gym, and surprisingly even tennis may get away without reconstructive surgery. So the take-home message here is that most average people with an ACL rupture can be treated with rehabilitation, and only half will end up needing ACL reconstruction for ongoing instability, although we are yet to identify which half this is. Outcomes around returning to sport, overall knee function, and maybe even the development of osteoarthritis are no different if you have early reconstruction, delayed reconstruction, or rehabilitation alone. So if you are considering having reconstructive surgery for an ACL injury, make sure you know what your alternatives are and carefully weigh up all your options.